As a parent of three elementary age children myself, this has been the topic of many conversations at my home. That's why I wanted to take some time today to talk with two experts, one in healthcare and the other in education. You know our medical advisor, Dr. Lindsay Jubelt, who's the Chief Medical Officer and Vice President of Operations for Mount Sinai Hospital in New York City. Today, we're also joined by Dr. Kristen Dicerbo, the Chief Learning Officer at Khan Academy, one of our AT&T Aspire collaborators. Thank you both for your partnership and thanks for joining this important discussion. I hope you guys are safe. Let's jump into the topics at hand and let's start off and talk about safety at school. I'd like to ask both of you, as parents, what should we be looking for from our educators to ensure students' health and well-being as they contemplate what their school year is going to look like? Dr. Jubelt, if you don't mind, let's start with you.
Yeah, that sounds great, John. Similar to a lot of the measures that are being undertaken at AT&T's offices, schools also have guidelines about how to safely return from the CDC. So when looking at returning to school, I'd recommend first reviewing your school or local school district's reopening plans to understand the steps they've taken to reduce the spread of the COVID-19 virus and make the physical space safe for the students and teachers. I would largely focus my efforts on three main areas. So first, let's talk about the physical space. It's important that a school is increasing their cleaning routine, especially for high-touch surfaces, such as counters or light switches or doorknobs. These should be cleaned and disinfected at least once daily and more frequently if possible. If students are sharing items and supplies, they should be cleaned between users. In addition, schools should also investigate their HVAC system and confirm that their ventilation systems meet the standards recommended by the CDC. The second element to consider is the students. Maintaining social distance is very important across the public and also in schools. So additional signage should be installed at schools to inform and remind students of new rules about how to appropriately maintain distance. Floor decals could also be used to help students understand. It's also helpful to understand how students will be grouped at schools. Plans that include staggered schedules could be some ways to mitigate the risks of transmission. Some examples of these would be if they only had half the class present in a school each day, or if pods were created with the same group of students staying together in the school at all times. This reduces the chance that different people are commingling and spreading it across a larger group of people. In addition to social distancing, masks should be worn at all times in school, except during lunch when there should be ample distance between students when students are eating. And then since we know hand hygiene is critical, make it easy to do this. Consider installing hand sanitizer stations throughout the school to improve access to good hand hygiene, and in case students do not have access to a sink in each classroom. We've talked about the space, we've talked about the students. Third and final, it's important to review and understand the school's plan if there is a positive or suspected case. Case management and contact tracing is a key component to preventing an outbreak. So every school should have a plan.
Thank you so much. Those are all great tips for us to think about as kids are entering back into the classroom. Dr. Dicerbo, let's pivot over to you. So once we understand and know about the health factors, what do we need to be thinking about from a learning perspective?
Hey, and thanks for having me today. So a couple of things that schools need to be thinking about, and you as parents are hopefully understanding how your schools are thinking about them, is first thinking not only about going back in person, but thinking about potential other models, either to start with or that might need to be implemented depending on the trends and the cases in your area. So first you want to think about, has your school thought about what might be done remotely versus in person? And if they're starting to think about remotely, what might be done, what we call synchronously, where people are doing the same things together at the same time, or asynchronously. And I can talk more about that in a minute. A second thing to think about is what are the learning tools that they have that could enable learning, particularly if you're thinking about remote options. So what do those look like? How are they available and accessible to you? And then third, how do we think about grading and assessment, particularly in remote, thinking about remote options, but also thinking about if there are interruptions in the school year, depending again on what happens. So thinking about how do students take tests potentially in a remote environment? How are students graded? All of those things you might think about and ask your districts how they're thinking about. And then fourth, how are the school and the parents communicating? What should you expect in terms of updates? How often, by what means? That'll give you a better sense of what to expect from them and know how to get information in the best ways.
To learn more about AT&T and our response to the coronavirus, subscribe to this channel, visit the AT&T newsroom, or watch more videos on the playlist seen here.